of clinical application of respiratory care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Peace and welcome to this midnight edition of shaking it up in the world by reading books and learning from masters. Coming to you live from the light. Picking up on chapter 6, Oxygenation. Yes. In this 18th edition. Page 123 of Clinical Application of Respiratory Care. We start out at the bottom of page 123, cardiac output. Body tissues require a given amount of oxygen per unit time. It makes no difference whether the oxygen comes from a great quantity of blood or a small quantity of blood. Thus, the oxygen consumption remains constant, and the amount of oxygen that must be extracted from a given quantity of blood is directly determined by the blood flow per minute unit time. In other words, if 25 milliliters of oxygen is required and utilized by an organ system every minute, this is the same as saying that the organ's oxygen consumption remains constant. Therefore, 25 milliliters of oxygen will be removed from the blood, whether 1 liter or 5 liters is supplying the organ system. As blood flow per unit time increases, less oxygen will be extracted from any given quantity of blood. In this manner, cardiac output has a significant effect on the venous oxygen content as well as on the total oxygen availability. Middle of page 124. Thank you for being here and reading books with us. Hi, it's Heart Love. Hemoglobin concentration. When a hemoglobin solution is exposed to a gas atmosphere containing oxygen, most of the oxygen entering the solution immediately attaches to hemoglobin. Oxygen that is attached to hemoglobin is not dissolved and does not directly exert a gas pressure. Exposing the hemoglobin to various oxygen tensions results in various degrees of oxyhemoglobin saturation. When the hemoglobin is exposed to oxygen tensions of 0 to 100 millimeters Hg, a sigmoid curve results. This is known as the hemoglobin dissociation curve. See figure 6.1, 6.2, correction, 6.2. Between oxygen tensions of 20 millimeters Hg and 80 millimeters Hg, the blood can exchange great amounts of oxygen with very small changes in oxygen tension. This means that the highest pressure of oxygen is maintained in the blood so that the greatest degree of driving pressure between blood and tissue is maintained for oxygen to be given to tissues. The hemoglobin is the major determinant of the total amount of oxygen that is carried in the blood. When the oxygen exchange with tissues takes place, the hemoglobin allows high blood oxygen tensions to be maintained while significant amounts of the oxygen are given to the tissues. The oxygen content is the sum of the oxygen attached to the hemoglobin plus that dissolved in plasma. Steps in the calculation of the oxygen content are shown in Table 6.3. Oxygen content is a major factor in the process of tissue oxygenation. The role of hemoglobin concentration in maintaining adequate blood oxygen transport cannot be overemphasized. Yes, beautiful. Okay, so, and here's table 6.3, calculating the oxygen content. We got here. Thank you so much for reading books. This peaceful part of YouTube where we read books and learn from masters. Hi, it's Heart Love. Here's table 6.3, calculating the oxygen content. It has grams percent and equals grams of hemoglobin per 100 milliliters blood. Volumes percent is equals milliliters of oxygen per 100 milliliters blood. Thank you so much for joining us in peace. Clinical Applications of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Second edition, 1979. Peace, everyone. Peace, everyone. August, we made it! August 21st. Peace, everyone. Hi, it's Heart Love. We had the grocery giveaway. It was slammed with so much work yesterday. We gave it all out to the people here at South LA Cafe. It was beautiful. Beautiful, beautiful. Okay, so it says steps, hemoglobin content, grams, GM percentage times 1.34 times SO2 equals oxygen attached to the hemoglobin volume percentage. Okay, and then 2, the PO2 times 0.003 equals oxygen dissolved in the plasma volume percentage. And then 3, steps 1 plus 2 equal oxygen content, volume percentage. Thank you so much. Thank you guys for the likes and subs. We're pushing to 500 in this peaceful part of YouTube where we read books and learn from masters. I'm a master fitness trainer. Thank you so much. This is MCAT material we're giving to you YouTube for free. So you just hit the playlist on any of the books and it'll just read the whole book with you. Thank you so much for being here with us. Hi, it's Heart Love. All right. So, and it gives you an example. Hemoglobin oxygen affinity. Hemoglobin has a certain affinity for oxygen, allowing blood to readily oxygenate in the pulmonary capillary bed. Extreme changes in this affinity can make the hemoglobin less capable of releasing oxygen to the tissues. Various factors alter this affinity, and in so doing, change the normal relationships between hemoglobin saturation and oxygen tension. In other words, a change in the hemoglobin affinity for oxygen changes the position of the hemoglobin dissociation curve. This is called shifting the curve. Figure 6.4. 1. Decreasing oxygen affinity. Decreasing oxygen affinity results in a shift to the right. For any given oxygen tension, there is a lower percentage of oxyhemoglobin. The oxygen transport capability of the blood is decreased because the oxygen content is decreased. It should be pointed out that a shift to the right aids oxygen movement from the blood to tissue. However, it also results in a decreased oxygen content. This decreased oxygen content limits the amount of oxygen that can be given to tissue regardless of how easily it leaves the hemoglobin. 2. Increasing oxygen affinity results in a shift to the left. For any given oxygen tension, there is a higher percentage of saturated hemoglobin. This means that the oxygen content of the blood is increased. The significance of increased affinity on tissue oxygenation may be profound. Ding! That's a big one. Thank you so much. Wow. Yes, we know it does, right? That's the thing. Like, even cancers, we know cancer cells cannot survive where there's oxygen. That's a fact. Wow. This told us. So. Hemoglobin may be thought of as an oxygen magnet in the blood. The stronger the magnet, the less effective is a given oxygen. Blood to tissue pressure gradient in transferring oxygen to the tissues. The greater the hemoglobin affinity for oxygen, the less effective any arterial oxygen tension may be in delivering oxygen to the tissues. It has been known for years that hydrogen ion concentration, carbon dioxide tension, temperature, and other factors affect hemoglobin affinity for oxygen. In an increase in any of these factors produces a shift to the right. Whenever there is a shift to the right, there is automatically a decreased oxygen content. Within limits, acidemia, hypercarbia, and hyperthermia will tend to cause decreased blood oxygen content and, by inference, increased oxygen availability to the tissues. This decreased oxygen content may greatly enhance the possibility of tissue hypoxia because the oxygen transport capability of the blood is decreased. Okay, and here is 6-4. The hemoglobin affinity for oxygen, increased oxygen affinity, shift to the left, means there will be a higher oxygen content at any given PO2. Conversely, decreased oxygen affinity, shift to the right, means there will be a lower oxygen content at any given PO2. And it shows in the graph the saturation level and percentage, which is O2, and then the partial pressure of the O2 on the horizontal. Thank you so much for reading books with us. Hi, it's Heart Love. Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Page 126. And down at the bottom. Studies of red blood cells have revealed that certain enzyme systems are responsible for aiding the dissociation of oxygen from hemoglobin. Many phosphorylase enzyme systems seem to be involved, but the most completely studied at present is the enzyme producing the substrate 2, 3 diphosglycerate. Oh, dipsulfoglycerate. 2,3-DPG. This enzyme system enhances the dissociation of oxygen from hemoglobin by competing with oxygen for the iron binding site. Thus, lowered levels of the enzyme will produce an increased hemoglobin affinity for oxygen, which has the same effect as shifting the curve to the left. The laboratory ability to measure such changes led to the development of the P measurement. Yes, this is big. The P50 is defined as the oxygen tension at which 50% of the hemoglobin is saturated under very specific conditions of laboratory measurement. Peace, peace, highest heart, love. Thank you so much for reading books with us. We are whew, moving on to page 127, MCAT material. Put in the playlist for anyone that will be aspiring doctors. We're helping the next generation, giving it out for free here on YouTube, reading the entire book. Thank you so much for being in this peaceful part of YouTube where we read books and learn from masters. So, now, in this graph, oxygenation, we're in chapter 6, page 127. So, the saturation O2, right, percentage is on the vertical bar, and the partial pressure O2, okay, is on the bottom bar. And you'll see the the measurement of oxygen affinity at normal pH and temperature at the hemoglobin curve. Thank you so much. Clinical application of respiratory care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. There you go. Excellent. 37 degrees C, PCO2, 40 millimeters Hg, and pH 7.40. Figure 6.5 illustrates the concept of the P50 measurement. Whatever the laboratory method for determining P50, the conditions of a pH of 7.40, a PCO2 of 40 millimeters G, and a body temperature of 37 Celsius degrees must be included. In most laboratories, PCO2 and pH are calculated in the final determination. It must be emphasized that pH, PCO2, and temperature changes in the patient will affect the hemoglobin affinity for oxygen. See figure 6.4, but will not affect the P50 measurement. The normal adult P50 is approximately 27 millimeters Hg. In other words, normal adult hemoglobin is 50% saturated at a PO2 of 27 millimeters Hg when the temperature is 37 degrees Celsius. The PCO2 is 40 millimeters Hg and the pH is 7.40. The clinical significance of the P50 measurement is not clear. In fact, some doubt its usefulness completely. The concept, however, is essential in understanding blood oxygen transport. Hypoxemia. Hypoxemia is traditionally defined as a relative deficiency of oxygen in the blood. Ding! Since arterial PO2 measurement has become the standard means for clinical evaluation of blood oxygenation, we shall define hypoxemia as a relative deficiency of oxygen tension in arterial blood. Such a definition is completely compatible with current medical literature and lends itself most readily to the clinical care of acutely ill patients. In the absence of a significantly increased hemoglobin concentration, hypoxemia is synonymous with a decreased oxygen content. It must be emphasized that hypoxemia is not always synonymous with tissue hypoxia. An arterial oxygen tension of less than normal is potential threat to adequate tissue oxygenation, but is not a direct reflection of tissue oxygenation. Thank you so much for likes and subs. Highest heart love. Page 128. We are pushing towards 500 subs. Thank you so much. Reading books in peace. Thank you. So grateful and thankful for all that I have now and all that is coming to me. I'm ready to receive. I believe. I know it. I deserve it. Thank you. All with purpose. We had great meditation yesterday with the great Lorianne Speed. All honor and love to the community grocery giveaway. See, I do can never be duplicated. Physiologic causes of hypoxemia. A simplistic statement that serves as a clinical generality is all arterial hypoxemia is due either to a decreased alveolar oxygen tension or intrapulmonary shunting. 1. Decreased alveolar oxygen tensions must result in decreased pulmonary capillary oxygen tensions. We have seen previously that pulmonary capillary oxygen tension. We have seen previously that numerous factors can cause alveoli to have decreased oxygen tensions. 1. Alveolar underventilation in relation to perfusion, shunt effect. 2. Decreased venous hemoglobin saturation. And 3. Alveolar hypoventilation when breathing room air. Two, intrapulmonary shunting is blood from the right heart entering the left heart without exchange with alveolar gas. See chapter 4, which we already read. When the adequately oxygenated blood returning from the lungs mixes with the desaturated blood, a decreased oxygen content results. Since the shunted blood contains poorly saturated hemoglobin, even small amounts, 10 to 20%, may result in significant decreases in arterial PO2. Intrapulmonary shunting is a common manifestation of pulmonary disease and is often responsible for arterial hypoxemia. It must be remembered that the degree to which a shunt will manifest hypoxemia is dependent upon the hemoglobin saturation of the blood that is being shunted. Thus, the hypoxemic effect of a shunt is as much dependent upon mixed venous hemoglobin saturation as it is upon the size of that shunt. Bottom of page 128. The pulmonary response to the hypoxemia. A significant decrease in oxygen supply, e.g., decreased oxygen content, decreased arterial oxygen tension, or decreased blood flow, may result in peripheral chemoreceptor hypoxia. See Chapter 1. This initiates afferent signals to the midbrain, where efferent signals are then sent to the ventilatory muscles. Theoretically, the increased ventilation should produce an increased alveolar oxygen tension, which in return should produce more blood oxygen and thereby relieve the chemoreceptor hypoxia. This mechanism for compensating for hypoxemia is inefficient for two reasons. It has little effect on the hypoxemia secondary to true physiologic shunting, since the blood that is exchanging with alveolar air is already adequately oxygenated. The increased alveolar tensions add little oxygen to the exchanging capillary blood and have no effect on the shunted blood. And two, a point may be reached at which the oxygen consumed for the increased work of breathing cancels any oxygen gained from increased ventilation. See Chapter 3. The pulmonary response to hypoxemia is quite efficient in circumstances where the hypoxemia is secondary to decreased alveolar oxygen tensions. Of course, increasing inspired oxygen concentration is a far more efficient method of raising alveolar oxygen tensions since it does not demand increased ventilatory work. Thank you so much. Highest Heart Love, Sizzle Moon Song. Right? Reading medical books. Highest Heart Love, Turtles. This visual's entire vibe. Oh, Highest Heart Love. Thank you so much for being here. Thank you for the likes and subs. We're pushing the 500 reading books on this channel. Man, I honor you. Thank you so much for the peace. So grateful and thankful. Highest Heart Love, Sizzle Moon Song. Yeah. We'll pause right here, reading clinical application of respiratory care, the bottom of page 129. Clinical application of respiratory care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Thank you so much for being here and reading with us. Highest heart, love, and honor. Where we shake it up in the world, reading books and learning from masters. Hey ya, hey ya, hey ya, hey ya, hey ya, hey ya, hey ya. Hey ya, hey ya, hey ya, hey ya, hey ya, hey ya, hey ya. Peace, peace. Thank you so much. Yeah, it's important for me to give the peace on YouTube. This is a peaceful place on YouTube, and I've just been doing so much. We have got a great Your Healing session coming up, so it'll be beautiful today. Hi, it's Heart Love. Thank you so much. You missed my earlier comment and blessing. If you are, thank you so much. Eldridge, Cleaver, Black. Yes, that's right. For the people, always for the people. Man, thank you so much. Hi, it's Heart Love. Let's drink some love water to that, right? Look at that. Flowers, bougainvilleas. Because I put flour and a little bit of lemon, and I made it, put it together, and then let it filter and assimilate. It's called love water. So, cheers to all the light workers. We're doing the work. We continue to do the work. Hi, it's Heart Love, and I love you. Mm. Oh, so you can guarantee I'm going to tell you I love you. Feel free to follow me on my socials as well, on like Instagrams, yeah, Uriel, Neville, or Uriel. Thank you so much for being here. Hi, it's Heart Love. I love y'all so much. I really do. That's why I'm giving you this information for free. I have to. Someone has to do it. And, I have the vocabulary to do it. So that's one, here's another gem. All right, make this up. Big gem. In deciding things, for me, it's always righteousness first, right? I ask myself two questions. Do I have the ability to do it? Right? That's right. So I ask myself, do I have the ability to do it? Then after I ask myself, do I have the ability? Then it's, do I want to? And so those are the only two things that I have to ask myself before activating. Because it's all about activating, right? As light workers, we have to show the peace in the world. We have to show stability and what balance is. And the respiratory care is all about balance and breathing. I love you. I love you. Thank you so much. Hi, it's Heart Love, and I'll see you soon. Peace, peace.